it's important to understand that an attack on Medicaid is a direct attack on the health of women.
So how do Trump's attacks on Medicaid jack up women's access to health care?
The reality is that when you attack Medicaid, it really creates a life or death situation for the people that we care for. It means that people cannot get the STI testing, they can't get counseling, they can't get gynecological care. The majority of folks who are living on low income receive their insurance coverage through Medicaid. 1 in 5 women rely on Medicaid for their insurance.
1 in 5?
1 in 5. And so it's important to understand that an attack on Medicaid is a direct attack on the health of women.
Why is Medicaid such a big deal for reproductive rights?
Imagine what it means that you cannot get the reproductive health care that you need because of where you live, because of your income, because of who employs you, or because you are unable to be employed. And so it creates a two-tiered system of care, right, where those with means and resources get the care that they need and those without do not. We can look to the 10 states that refuse to expand Medicaid to have a clear example of what plays out in our communities when Medicaid is decimated. It means worsening maternal health. It means worsening infant and child health. It means worsening community health more broadly.
What have you seen change for doctors and clinics?
It's hard to really pick apart the impact on cutting Medicaid and the impact of all of the horrible policies that are being passed by this administration. What we know is that folks are not getting care. Folks are afraid to come in for care, right? The attacks on Medicaid are directly tied to attacks on immigration. They're directly tied to attacks on abortion access. They're directly tied to attacks on gender affirming care. All of these things combine to create a perfect storm of harm for people who need care most. And so the way that doctors are seeing this play out is that folks are coming in and they're confused. They don't know what's legal, what's not legal, what's covered, what's not covered. They are unsure about whether or not they can even come and see their healthcare provider safely and get the care that they need without judgment and without stigma. And so it's created a chilling effect for our healthcare providers and for patients in our communities that are seeking care.
A lot of people don't understand how intersectional these issues are, and that inequality for one group in access to healthcare creates a public health crisis for all. Could you talk a little bit more about that?
So it's important to understand that if I'm not free, you're not free.
Yeah.
Our liberation is bound to one another. And so when we see attacks on any part of care, on any specific community, rest assured they're coming for you next.
They're coming for you.
And this has played out time and time again if you look to history, right? We know that there have been attacks on abortion since the passage of Roe, since 1973, for example. The playbook that they have used to gut and undermine abortion access in the states are the same ones that they're using now to eliminate access to gender affirming care, are the same ones that they're using now to attack maternal mortality programs. Imagine that. For the same administration that is claiming to care about women and children and families is the same one that is gutting the social safety net, that is eliminating research program for women's health, that is really attacking healthcare providers and people that are seeking care. So it's important that we look at these issues in the intersectional way that they play out in our lives. So I am an abortion provider, and I also provide care in so many other areas. And people come to me with all kinds of issues, not just one. And so it's my duty as a doctor to care for the entire person, not just that one issue. So when we're thinking about our advocacy, when we're thinking about our activism, our approach has to be intersectional as well.
If people are really mad about what is going on right now, how can they channel that anger? What can they do?
The first thing I'll say is congratulations, welcome to the party. We've been mad for a really long time, and I'm so glad that you're here. The first thing I would do is contact your legislators. The most important thing to understand is these people work for you. You are their constituents. They must be held accountable to your wishes and needs. 2, educate yourself on these issues, right? You don't have to know the ins and outs of embryology and fetal development. You don't have to know how contraception works. You don't have to know all of those things. The only thing that you have to understand is that these are assaults on our human rights. And that is the first place to start. I would absolutely encourage people to look into organizations that are doing work in an intersectional way. Reproductive justice and community-based organizations are really good examples. And the other thing that I would offer is really to take a step back, right, and to listen to folks who have been doing this work for a long time. Organizers on the ground, particularly Black women and trans folks in the South, have been organizing around these issues in an intersectional way for decades. And so for us as a national organization, an organization of people of privilege, we're doctors. And so that comes with a significant amount of privilege. We take our lead from organizers in community on the ground always.
We can't do it alone. We need everybody's help, so we need you to call your congressional members.
Absolutely.